Hello, my name's Dr. Ben Allen. I'm a GP in Sheffield. I'm going to do a little experiment with just kind of running through a few things that have happened in my day as a GP, just to give you a bit of an insight as to what the work is like, and also I think there'll be some interesting topics which kind of are quite common things that we have to think about and manage in general practice that might just be interesting just to hear what some of those things might be. So today, interestingly, I've just been back from 10 days off. And I guess that's been on my mind today is it's taken me about a week to wind down. I think that the pace of the work means you just need a lot of adrenaline, and it took about a week for the adrenaline to start to get out of my system so I could start resting. And actually coming back to work, I was pretty anxious, to be honest, because I didn't have the adrenaline anymore, and I was like, how am I going to actually do the amount of work that is a normal day's work in general practice without that adrenaline? And thankfully my team I was able to talk to them about that, and they were very kind in terms of helping me to have a day that was likely to be more manageable. And already by the end of the day I'm starting to feel a bit more like I'm getting into the swing of things. I went to a care home today, so that's one of the things I do every week. And there's a chap who had dementia and was more confused than normal, and really had no other symptoms at all. Examined him again, nothing in particular. So we just got a gentleman who, confusion can be lots of things that could potentially cause that, and but nothing particularly to find. And then you've got this kind of question of, do you kind of be very thorough and start doing lots of blood tests and scans and things, or do you just leave it for a few days and see what happens? So we've kind of gone with that approach of seeing how things evolve over time. We don't want to cause lots of disruption for him, and actually confusion can come and go. So we've gone with that as an option for today, and I'll review him again on Friday. An interesting one was around medication reviews. So I had a lady, and this is again really common. People accumulate medications as they go through life, and often, when people are younger, we both treat people for symptoms. So we want to make sure that people kind of don't have bothersome symptoms, and we also are very proactive in starting medications that might improve people's kind of length of life, so the quality of life, as well as helping people to live longer. And often there's a point as people get older that actually the quality of life is the only thing that matters to them, and and it becomes less of a priority to take tablets that might enable people to live longer. And one of the challenges is that often the medications that help you live longer can also reduce your quality of life. And when you're dealing with people who are in their 80s and 90s on tablet, this lady was on 18 medications, the benefits start to seriously become questionable when you're on that many tablets, because as you get older, your ability to be able to cope with having that many tablets at once starts to and actually she had very low blood pressure, and despite being on 2 blood pressure tablets, it's actually quite risky, really. And the other thing is that we generally there's guidelines for every medical problem. So if you follow the guideline for every medical problem, you end up with people on dozens of medications, when actually if you look at someone as a whole, you might think, okay, these things are priorities, we give medications for these things, but these things are not priorities, and then so that's what I've tried to do today. So actually she's only on 10 now. We've managed to stop quite a few that really weren't helping her with the priorities that she had in life, which was just to have the best quality of life that she could. And then finally, in the afternoon, it was quite a bit different today. We had a meeting with our network. So networks is something that we maybe don't talk about very much, but there's been a change within the government to start, rather than funding general practices directly, they're also funding a collection of a collection of GPs that work nearby each other, to have a shared budget to work together. And we're a few years down the line now, and we've not had many face-to-face gatherings. So we did do today, and we spent some time celebrating what we've done so far. And there's some really excellent work with sharing physiotherapists. You can see people who have new problems with musculoskeletal problems. They can see a physio now instead of a GP, and that's an excellent service. We have social prescribers who can have been really helping people who maybe have more social difficulties and they need support with that. We've got our pharmacists who help us with managing our medications, and pharmacy technicians. We've got a volunteer coordinator to try and help get more volunteers into general practice as well, where that's helpful. And there's many others. So it's just been really helpful, really nice to meet people from other practices and see the kind of vision that we share, and also thinking about the future. You know, there's new funding streams coming through now that we need to decide how we're going to navigate that, and how do we make the environment that we're in, how do we thrive as practices and help our patients to thrive, So now I'm just trying to get through some of the work that was left, that I kind of gathered whilst I was away. So there's quite a lot of tasks from patients that I need to follow up, and other things. So I'll be trying to work my way through that, because I'm on call on Friday. So on Friday, I'm very much the person who's supporting all the clinical staff and helping all the most sick people. So I need to make sure that I've kind of cleared all my admin if possible. So that's what I'm going to be doing now before I cycle home. All right, hope some of that's been interesting and helpful, and I'll hopefully put something else on maybe on Friday if I can manage it.